Well, welcome to Alison and Deb and all of the leadership and everybody involved in today's AHHA think tank. It's a 2-day event and it comes 2 weeks after the budget. When I presented to the post-budget breakfast, I talked about some of my personal motives, and I know that yesterday you had the very difficult discussions about palliative care and end of life. Our family is like every other family. And I remember when I was called in by just the wonderful doctors and nursing staff at Frankston Hospital to sit with my father. And I realised we weren't counselling him, they were all counselling me about his last days. And then we went on to spend time at the Mornington Peninsula Palliative Care Centre, and it was a very difficult time for everybody, but a very beautifully cared for time. And the sorts of things you're doing through palliative care, of course we're supporting with an additional $8 million of funding, but it's not the funding. It's the support and the belief and the structure. And everybody is on a health journey. And our shared task is to build what I believe can be the best healthcare system in the world. It is an outstanding healthcare system. For all of the challenges that we face, when you sit back and look, we have an outstanding healthcare system, and that is largely due to yourselves as the hospital administrators, leaders, visionaries, to our magnificent doctors and the training system, to our magnificent nurses and their training system. As the son and the husband of nurses, I really believe in their role in the system. So against that background, what I've tried to do since coming in, working with the profession, is to look at the pillars which will help take our outstanding health system to being genuinely the world's best. The first is about guaranteeing Medicare and the PBS, and that's not about some nice set of words. It's about the things we've just done in this budget, of investing $1 billion in re-indexing the Medicare rebate schedule, $2.4 billion in Medicare all up, and $10 billion in the health system. But these dollars are only a means of actually doing things, of providing palliative care, of providing better early intervention. In particular, the theme of today's work of turning the avoidable hospital admissions into the avoided. And that's really what I want to explore over the next year and a half, and to turn that into a reality through your ideas and suggestions. It can only happen that way. So this is real reform in the best sense of giving people better health care, better outcomes, and improving the efficiencies which can then be reinvested. So we have worked with the AMA and the College of GPs, with Medicines Australia and the Pharmacy Guild, and with the Generic and Biomedicines Association to achieve outcomes through partnerships which then allow for reinvestment. With the doctors, what we've been able to do is to achieve reform in relation to the medical benefits schedule and their support for the reviews, in relation to the healthcare homes program and the ability to focus in trials on outcome-based payments, and then also the My Health Record, getting the states on board, and the AMA and the GPs and the Guild. All of these things have been fundamental, and the My Health Record will now roll out to all Australians who can opt out, but I believe that within 2 to 2.5 years we'll have 23 million Australians, and the task now is to turn those records into active engagement, so as we have real reform, real transformation of people's lifetime ability to know their vaccinations, to know the illnesses they had as a child, to know what testing in pathology and diagnostic imaging they've already had, to avoid senseless and unnecessary duplication, which will again allow for reinvestment. Beyond those reforms, we've had the agreements with Medicines Australia and the Pharmacy Guild in relation to the pharmaceutical benefits scheme. In particular, what we've had there is Medicines Australia agreeing to reduce the prices they've been paid for their drugs, and will be paid, by $1.8 billion over 5 years, in return for reinvestment in the pharmaceutical benefit scheme. So as a drug such as Entresto could be purchased, funded and made available for 60,000 Australian patients with chronic heart failure, the vast majority of whom could never have afforded this magnificent life-saving drug. That's what reform is about. The Medicines Australia or the pharmaceutical companies have accepted lower prices in return for reinvestment. And you know what? That puts the pharmaceutical benefit scheme on a stable basis. The strangest thing in coming into this job was the fact that there was no headroom built in for new drugs. That's how governments in the past have faced many challenges, how things such as the indexation freeze on the medical side came about to pay for the pharmaceutical side. With these reforms, we get more drugs, but we protect the overall strength of our health system. And again, with the pharmacists, we've been able to reinvest with them the savings made by greater uptake of generic and biosimilar medicines. It achieves the same outcome for the patients, but it allows us to assist with stronger community pharmacy activities. That's the real outcome there. Beyond the $2.2 billion that goes into the pharmaceutical benefit scheme, in your area, there's $2.8 billion going into our second pillar, which is supporting our hospitals. And what that does is it builds on the announcements and support made through going to the activity-based funding model under Malcolm Turnbull to achieve an outcome of $7.7 billion all up for our hospitals. And that is a very significant addition in 18 months under Malcolm Turnbull. And to be able to be part of that, to be able to assist you to do more things, to reduce waiting lists, that's really satisfying. The third pillar is mental health and preventive health. I just want to focus on one of the elements here, and that's the mental health. You all deal with something that is fundamental here. That mental health challenge is faced by 4 million Australians a year. My family, your family, almost every family in Australia has some form of linkage to mental health challenges. The $173 million we're putting in, it's a big number, but it's about continuing the push to deliver more community mental health services, and in particular, supporting those who are not within the NDIS with stronger psychosocial community support services. So it helps those who aren't in the system by assisting with additional services. There's also a very significant $230 million package for cancer, $150 million for making sure that we have screening, in particular breast cancer screening, and $80 million for medical research directly into cancer, including Australia's first proton beam therapy treatment centre and $10.8 million for families who are dealing with the terrible blight of childhood brain cancer and other childhood cancers. That's all part of an additional investment of $1.4 billion through the 4 years in the Medical Research Future Fund. We're on track to double our medical research funding on an annual basis, and that will help us in motor neurone disease, in cystic fibrosis, in cardiopulmonary conditions, right across the spectrum. Then as we go forward, there are really 3 waves to the reforms. The first wave has been Medicare and the PBS and mental health reform. Over the next year, it's private health insurance reform and mental health reform. And then over the final year, it's the work you're doing now on helping to achieve real changes where we move people from hospitals to primary care. So I'm open to your ideas. I welcome your ideas. I hope that Alison will come and see me soon with your suggestions. And this is the critical third wave, the great transformation in Australia's hospital system, the migration from avoidable to avoided hospital procedures, where primary care plays a critical preventive role. I welcome what you're doing, and I invite your ideas, your suggestions, and your proposals.